First of all, I would like to reinforce the definition of multiple things in the topic. First of all, I would like to say that healthcare in 2005, the United States and other member states of the World Health Organization signed World Health Assembly Resolution 58.33, which states, quote unquote, that everyone should have access to healthcare services and should not suffer financial hardship when obtaining these services, so it ought to be a right in the definition of the WHO. Secondly, I would like to refute the arguments that have been made by the opposition. First of all, although the opposition may have rightfully claimed that universal health care may invariably raise taxes in multiple different countries, healthcare in terms of like cost and all of that, in terms of private healthcare, will invariably raise taxes. The taxes individuals pay for universal health care pale in comparison to the cost of private health care. So paying taxes, for instance, will just be a tiny comparison, or will just be a tiny percentage of what individuals who do not have health care in other countries would pay. Secondly, according to the United States Census Bureau in 2012, there were 48 million people in the United States without health care, and as the opposition previously stated, even though they stated that there are true facts that the United States and the United States citizens do not believe there should be universal health care. In fact, that statistic does not overshow that there are 48 million people without health care living in poverty and not deciding to have health care. Secondly, I would like to reinforce the contentions of the government. First of all, contention one, establishing a right to health care would most definitely lower the costs of health care in all countries. According to multiple statistics, including the American Journal of Public Health, Canada, a country that provides universal health care, spends half as much per capita on health care as the United States does. Furthermore, broadening out to different countries, as the opposition has said, they have said that we have only specified on the United States, we are also specifying on Canada, United Kingdoms, and other sources. And in 2012, the United Kingdoms, another country with a right to health care, managed to provide health care to all citizens with spending just 41.5% of what the United States did per capita. Yes.
How do you expect a nation to support Zimbabwe to institute health care in the first place?
Well, healthcare is, in this definition, we're saying for governments that are strong, that are federally funded, would be able to provide healthcare, and third world countries may or may not be able to institute such developments because they still do not have the basic tenets of government. Second of all, a right to healthcare could definitely make medical services affordable for everyone. According to a 2012 study from Consumer Reports, paying for healthcare is the top financial problem for U.S. households. So even though a plethora of individuals in the United States do not believe that universal healthcare ought to be mandatory in any way, it is definitely a huge financial issue in the United States and other governments around the world. Moving on to contention two, a right to healthcare could save lives, and there are multiple anecdotes that show this. For instance, a New York Times article in 2012 has shown an anecdote that an individual with the flu in New York City, he believed that he did have the flu at first. He didn't want to go to the doctors because he didn't have healthcare, he didn't have healthcare coverage, and it turned out that he did in fact have a different disease, Lyme disease, which was manifested to him by deer population. So in fact, he did suffer from paralysis on his lower waist, and I'd like to mention that life is definitely invaluable, and in terms of something like this, healthcare should be able to cover him in that sort, and something economic, like an economic burden like that, should not be able to mitigate his results to live life to the fullest and achieve his happiness, pursuit of happiness. Third of all, contention three, providing all citizens the right to health care is obviously economically advantageous. Individuals live healthier lives and miss work less because everyone that has affordable and accessible health care will be able to go to work on a daily basis and will be able to treat their sicknesses in a collective manner. According to an Institute of Medicine report, the U.S. economy, quote unquote, loses 65 million to 130 billion annually as a result of diminished worker productivity due to poor health and premature deaths. among the uninsured. So the uninsured most definitely are not able to go to work as much as other individuals who do have healthcare, and implementing a universal healthcare system would obviously be economically advantageous and would help them in their social and health life. Furthermore, I'd like to just conclude by saying the government has made many different propositions that say healthcare is both economically advantageous, socially advantageous, and in terms of health, very advantageous. And lastly, I would like to make another point, that another contention that the quality of healthcare is deemed, or the quality of universal healthcare or federal healthcare is usually deemed morally instituted, like in a federal standpoint. Countries do in fact institute it in a more moral standpoint in terms of, in relation to corporations or other companies that only profit off of the sicknesses of others.